When an emergency happens, we count on first responders and physicians to get us the help we need. But in rural Wisconsin, the nature of rural emergencies can look a lot different. News 8's Madeline O'Neill can tell us about today's rural disaster drill.
Sarah, about 25% of the state's population lives in rural areas, but only about 10% of physicians live in rural areas. That's according to the Wisconsin Academy for Rural Medicine, which is a program working to train more rural physicians. Today, its students got a taste of what rural emergencies can look like. An annual rural disaster drill is standard for the Wisconsin Academy for Rural Medicine, known as WARM.
This is definitely going to be the hottest day.
But on this fall day, it's downright hot.
We're expecting to be pushing the 90-degree range.
One of the many lessons of the day, however, is you must be prepared for anything.
You don't know what you're going to walk into.
From a grain entrapment to a logging accident.
Unconscious.
26 WARM students based out of Marshfield, Green Bay, and La Crosse join area first responders on a rural La Crosse site to practice various emergency scenarios.
If they're seeing patients in the hospital environment, it helps them know what's happening in the field beforehand.
It's good for recruiting doctors who want to practice in those areas and also teaching them about the specific challenges that we might face someday.
Yep.
Third-year medical students Laura Kruger and Miranda Coley are seeing firsthand the specific challenges that come with rural emergencies.
It's amazing the amount of prep work that is required before they even go out on the scene, and the amount of things that they have to have on hand and just, work with what they have or what they don't have.
Go get the other drill, the other auger.
Well, the real issue is kind of access to health care in rural areas.
WARM Director Byron Krause says it takes longer for emergency responders to get to rural emergencies, especially when they're off the beaten path.
That delay in access to care results in worse outcomes.
And when every second counts, it makes it that much more important for personnel to be prepared.
You guys remember what the vital signs were?
Coley and Kruger will take home many lessons, one being that rural medicine is in fact the right career path for them.
Yes, oh, for sure.
This has been great so far, and I'm really excited to learn more.
The medical students wore the heavy protective gear firefighters wear during part of the drill to know what it's like. As you can imagine in this weather, especially today, you get hot quickly wearing that gear. Part of orientation this morning was reminding everyone to take care of themselves in the heat.
All right, thank you, Maddie. Today's drill was also practice for local emergency responders, including Stoddard, Shelby, Campbell, Coon Valley Fire Departments, and Gunderson Medlink Air.